on your YouTube, just connect it directly and keep it on the floor, but lower the volume. Just keep it on the resume. Mountain, Mountain. Sorry, this I have removed something. Oh, and this is the number 1020 time that I'm forgetting to connect this. Okay. Okay. Thank you. Okay, this bottle is visible. You're going for office. You come back when you want to. So you leave from there, you go down, or you come back?
I don't know, I'll ask them.
Okay.
I want to go to Bangalore.
It's okay. But the driver will soon be coming to pick you.
Okay.
Okay. Alright. So how are you feeling today? Tell me.
I see him messaging if you need him.
Yes. Tell him that he should give you 15 minutes. The nurse will be coming down for him to take her to the back.
Okay.
Okay. So today we'll be talking about the code of conduct. And I know yesterday you see we're going to Qatar and you did cultural shock. Do you have any questions on that? Well understood, was it? Okay. So today we are going to continue with code of conduct. And as you know, I'm Nurse Aisha, I'm your nurse supervisor. And we are going to be working for the period of time that you will be here until when you decide to part ways. Until when you decide to part ways. Until when we decide to terminate the contracts. After 2 years, okay? But today we'll be having a deep conversation on what is the code of conduct and what does it mean to us as nurses. We've been working for a long time. I think the nurses that are coming to see me. No. The driver is already outside, okay? I know. Whatever you do, we'll know that the driver is down. So when you finish, go down. Or you write Mr. Ajay directly. So what you understand as the code of conduct from your home country, certainly before you do a procedure, they will tell you the procedure has to be in a certain manner, right? The procedure has to follow a certain rule. The procedure has to follow a certain policy. And you cannot do this, you cannot do that, you cannot do this. All the things that you cannot do and what you can do and what will happen if you do what you are not supposed to do. Is that true? The same here in Qatar. We have a code of conduct that guides you as a nurse on what to do and what not to do. Is that understood? Okay. However, if you don't understand my language, tell me to take it gradually. Okay? And you're free to ask your questions anywhere where you don't understand. Now, to start with the code of conduct, what are we struggling to learn here and what are... Yes, tell me.
Everything is okay.
Okay.
Molly was requesting if she can go to data flow with the driver.
The driver has to go to the bank now. But how long does she want to take? Molly, come to me. How long do you intend to take?
I don't know.
The driver has to go to the bank with this lady. So I don't know, and I have not given him your program for today. You were supposed to tell me that yesterday. Is he in the office?
No, doesn't.
Have you spoken with him?
No, he left before I spoke to him.
You spoke to him on phone?
No.
Okay. I cannot make your program now. Can I make the program for tomorrow?
Yeah.
Okay. But know that you are waiting your time period for shadow. So if they confirm to me today that you have a patient, that complicates you the more. Please, can you text the driver tell him to wait for the nurse to go to the bank, and from the bank he will take money to data flow.
Okay.
So let them make that arrangement for you. Is there a particular time that the people from data flow closes?
Yes, 2.
2.
Yes.
So you still have some time. Okay. Make the arrangement for me, please. Okay. Now, what will be your learning objective? Number 1 is to understand the importance of adapting or adopting a code of conduct. Now, you will adopt the code because I know in your home country you have different codes. You have different things that you do that might be normal there, but here it's not. And when you have adopt, you'll be able to adapt and live with it as a part of you. Because at the end of the day, we are expecting that you disintegrate from this way and integrate here. Number 2, what is ethics? You need to understand what ethics is all about. There is one thing that is missing in our curriculum as nurses is the culture that we are going to be facing as nurses, as well as the code of conduct. It is when you start working that every hospital has internal policies and all the other policies. Not saying that we are not governed by bodies. There is the American Association. There is every association in each and every country that you go that governs their way. But do we actually get in depth in all this? No. So here you have the opportunity to understand all that. Next, we'll discuss the importance and the need for ethics as a nurse. Because we are dealing with human beings, anything that you do can send one person to the grave. So there is a need for that. Number 3, we will understand what are values, what are morals, what is ethics, and the combination of these 3 to give us the decision that is made by a nurse to carry on a particular thing. So you will see at one point I will not be very nice, or I will come so hard on you, not because maybe one thing you did was wrong, but because of the decision that you took to do a certain thing. It gives questions to your values, it gives a question mark on your morals, as well as it gives a question on the ethics. Next, we'll be looking at the American Nursing Association Code of Ethics, which guides us, which is a base for the people of Qatar. They are either using the American or they are using the International Code of Conduct for all nurses. Next, we are going to discuss all legal and ethical considerations that we have here in Qatar. So this is what you are going to be seeing as the body of this code of conduct. Number 1, what is ethics? They say it is a well-founded standards of rights and wrongs that describe what humans ought to do. A well-founded standards of rights and wrong that defined how or what human beings ought to do. Now, when we are talking about the ethics in Qatar, it's going to apply to each and every one of us, because that is the standard that has been put by the Ministry of Public Health here in Qatar to govern all nurses. So it is not something that we are only telling you. It is something that we have told each and every nurse. It is something that I have followed and I'm still following and will still follow until the day I decided, you know what, I don't want to be a nurse. But until then, these are the principles, the standards that each and every one of us has to follow. And then we will be looking at the obligations that we have to our patients, the benefits to our society. We need to keep our patients safe. We need to keep our patients alive. We need to be right in medication and every other thing. And this to the society is keep its population. If we start to do wrong and you are in the ward and you have to care for 6 patients or you have to care for 4 patients and you decide to administer all high alert medication without any consideration, what do you think will happen? All nurses are going to die, all the patients are going to die.
He wants to go with the both of them together.
Let him go with the both of them.
Yeah.
He do it the way he wants, he just needs to know that this is what he has to do. Okay? So if we decide to use high alert medications without following every principle of medication administration, all our patients will die. What will happen to the society? Everybody will be mourning, including us. Because why do you think that you're a nurse, your children are not nurses, are they? Your husband is not a nurse, is he? Your mother is not a nurse, is she? So if you can do this, and now you're in Qatar, some other nurse might be doing the same wrong thing to your family, so we all are going to be in a mess. Next, the fairness and the specific virtue. When we talk about fairness, we talk about the fact that you should care for a rich and a poor in the same manner. We talk about you taking care of the healthy and the people with special needs in the same manner. We are talking about you taking care of the old and the young and the babies in the same manner. That is not making priority when you're not taking care of somebody that is rich, you become all sweet, gentle, and nice. And when you're taking care of somebody that is poor, you become all rude. Now, we nurses these days, we have a master's degree of rudeness, which is not supposed to be so. You will now step out to go to... Okay. Please, there's another nurse that is for interviews now. You guys are going together, okay? So don't allow him to kick. Tell him that there's somebody still up. She's inside the other office for interview. You understand? So we must be fair in the way we care for our patient. I don't care if you're taking care of a special child. I don't care if you're taking care of an old demented patient, psychotic patient, a healthy adult, or a rich or a poor person. I am expecting you to care for them holistically, with all kindness, with all sweetness, with the humanity that is supposed to be in a nurse. Is that understood? Next, we will be looking at decision making. And that is why I say, for you to be able to take a decision as a nurse, it is a combination of your ethics, it is a combination of your values, and it is a combination of your morals. So the ethics, the values, and the morals is what gives you the decision that you need to take for a particular thing. And as a home care nurse, I am expecting your ethics, your values, and your morals to be very high, because you are the only one at the patient's bedside. If anything happens to that patient, the only person we are going to be asking the questions to is you. I was never there. I will not be there. The doctors will not be there. The case manager for that patient will not be there. The physicians will not be there. Nobody will be there to see or to evaluate how it happened, when it started, and how it ended. Everything we are going to be taking is what you are going to tell us. So I am expecting that if anything happened to the patient, if the patient is reported for maybe a bruise, an injury, a fall, it should be something that was out of your control. It should not be something that you caused. Is that understood? If any decision ever comes up and they said that the nurse is maltreating or abusing the patient, that is not just an offense that will be managed at the level of the company, it is an offense that will be managed at the level of the law. Is that understood? Okay. Now, from here, we will be looking at the definition of values. Values is personal. And that is why, when we are talking about values, we can distinctively classify them as per the individuals. Because the value is something that you, as an individual, has come to decide that this is the way that I need to do certain things. This is something that is right according to me. This is something that is wrong according to me. It is personal. And that is why you can have different people have different values, but they are living in the same house. Now, when we go to the morals, when we go to our morals, they are set of rules for what? That differentiate the right and wrong based on the society, on the culture, on the religion of the individual. So the people of Qatar are Muslims. Their morals will depend on what? Their wrongs and rights will depend on the beliefs they have in this society, which is the fact that they are Muslims. Their culture, they are Muslims. Their religion, they are Muslims. So it is a complete societal decision that you will see in each and every category that you will meet. And this is because this is how they have been grown. This is the traditions, this is the way their society believes, and every one of them have the same. So that is why you have to combine the societal plus the values. The ethics are societal, the morals are societal, but the values are individualized. So you can meet a set of persons who believe in the same thing, who have the same rules and regulations, but their individual beliefs are different. If you are in Qatar, you meet everyone on the street well dressed. You meet everyone in their hijab, in their abaya, everything, and everything is okay to them. However, they might take a personal decision that you will question why this individual is different. And that is because their personal values about a particular thing might be different. If you live from here and you go to America, you meet people that are walking on the street with bra and pants, and it is okay. You can't try that here. In fact, somebody who do not know you, who is passing the car, will call the police for a mad person on the road because it's not normal. Does that make those that are doing up there their moral standards low and this one high? It is a society that they were brought up in. The ethics and every other thing combined together that has made the people different. Is that understood? Okay. Now let's go to what is ethics in nursing. Because generally, if you go to the different industries that we have, whether it's building, whether it's acting, whether it's agriculture, whatever industry you meet, they have ethics. They have the things you're supposed to do, the things you're not supposed to do, and those rules and regulations and those ethics govern them. Now, when it comes to nursing, what are the rules and the regulations that govern us? We have here the set of shared values and principles that governs the way nurses interact with their guests, number one, with the family, number two, with doctors and other nurses. And this is why we are going to stress on the relationship that you keep with your guests, with the family, with the doctors, with other nurses. And number two, it is equally the set of relationship that governs you and the administration. Because we have internal rules and regulations, as well as we have general rules and regulations that you will need to follow to be able to walk through this your path of growth in peace and quiet. What is the code of ethics? One, with regards to professionalism, a code of professional standards containing aspects of fairness, duty to the profession and general public. Fairness, duty to the profession and the general public. Two, to the organization, it is the ethical behaviors, guidelines which govern the day-to-day activities of a profession in a particular organization. Next, the state, that is to the state, okay, the country itself. It is the set of rules and principles that regulates the rules, the development of a particular community that promotes the well-being and guides individuals to fairness in their behavioral actions towards their patients. Next, two, the profession itself, which is you, it focuses on the range of issues, including impact on the media, technology, health issues, and differences in family context. As a nurse, what am I supposed to do? that can impact my patient. If I snap a picture, if I do a video and post online, you will go to jail before you go to your own country. If you are in Europe and your patient agrees and you do the video and you post online, it's okay. But here it's not, even if your patient agrees. Do you understand that? Okay. What does ethics do? What is this code of ethics does? Number one, it provides a framework for reflection about ethical responsibilities of the nursing profession. If you think of hurting your patient, if you think of neglecting your patient, if you think of being rude to the patient's family, if you think of being rude to the administration, what does the ethics mean? It gives you a guideline to which by the time you want to feel like, I want to sleep instead of taking care of my patient, it sticks to you that what you're doing is wrong. It is against the ethics of your company. Even though you're working night shift, you cannot sleep on duty. You are supposed to be working. Because that is the period assigned for you to work, not to sleep. Even if the family member tells you, you know what, when the patient is asleep, sleep. You cannot. And you need to tell the family that I am sorry, that I'm not disrespecting you, but I am here to work. And if the patient is asleep, that makes me what? A watchdog. It means I can carefully assess my patient and make sure that they are sleeping comfortably. I can equally, if you are taking care of a bedridden patient, you know that you have to tell the patient every hour. If you are taking care of a patient with suprapubic catheterization, you know that you need to do the drainage after every 1 hour, 30 minutes. So why will you be sleeping when you have a patient that you're supposed to care for? If your patient is on complete mechanical ventilation, why will you be sleeping? You need to take care of your patient. Now, we have to look at what does the code itself stands for. This is CODE. Number one, C stands for what? The courage to be moral. It is not easy to do the right thing, be it whoever. So for you to do the right thing, that is why we say that word. The courage to be moral. The courage for you to understand that I, as an individual, can actually do what is right. I can go on duty even though I'm not being watched by anybody, except just know that there's a camera in the patient's room. Even if you're not seeing it, there is one. Even though nobody is there to tell me to give medications on time, I must give medications on time. Even though nobody is here to tell me that I should change the catheter or I should do the drainage every 3 hours, I should be able to do the drainage every 3 hours. Even though nobody is here to tell me that I need to tell my patient every after 2 hours, I should be able to do that. Because it is actually difficult to do the right thing and easy to do the wrong one. But the benefit of doing the right thing is that you do not have the consequences of doing the wrong thing. The O in code stands for what? The obligation to honor what is right. The obligations to honor what is right. So even though you need courage to do the right thing, you equally have an obligation to do the right thing. So you have to find that courage to keep on doing the right thing for 2 years of contract. And when you renew your contract, you have the courage and the obligation to continue doing it for the next 2 years. Next, D stands for what? The danger to manage. The danger to manage your fears. Okay? You have to draw a thin line. I want to sleep. But your subconsciousness tells you, this is wrong. You cannot sleep, you have to be awake. Now, because the patient is having, or the patient starts having difficulties in breathing, instead of assessing and making sure that you get the right diagnosis, You just for that reason says, oh, this is hyperglycemia or this is hypoglycemia. Okay, imagine to say that this is hyperglycemia and you administer insulin without checking the blood sugar level. Why the patient was actually hypoglycemia? What will happen? The patient will go deeper, will get into shock, will get into whatsoever complications, and where does that keep you? In the face of jail. It was your error. Because you did not have the patient to do everything that is right, to come out with the right diagnosis, and to be able to manage your patient correctly. That is why the care plan is. The care plan has standards, and those standards need to be followed. The D says that what? The expression and actions. What action do I need to take to maintain integrity? The expression and the actions. I do not need you to do the right thing while looking like a devil, while looking like a demon, while being angry. I need you to do the right thing while being happy, making sure that you are encouraging the patient in the right way, making sure that you are keeping the patient in the right mood, making sure that just your smile alone is capable of lightening the room that you are. You do not go to duty and the patient is like, what type of a nurse did they send to me this time around? She does not smile. You will be the reason why the patient is in depression. You should be the reason why the patient is smiling. You should be the reason why the patient is giggling. You should be the reason why the patient decided this morning, you know what, I want to take a walk. I want to try to move. I want to try to exercise. I want to try, because your happiness is infectious. It will radiate around the patient. It will radiate to their family members. It will make them have a sense of ease that you are the right nurse and you are here because you know exactly what you are doing. Is that understood? Next, we have professional organizations. What are the professional organizations that will help us keep us in track? We have the American Nursing Association. We have the International Council of Nursing. Here we equally have the Qatar Public Health website, which you, as a nurse, must be licensed before you are able to be sent to a patient. Is that understood? I know your license is not yet out, but it will be out after your ID is out. Okay. The next, we have clinical patient and family issues. What are the general things that you'll be facing when you get to the patient's home? Because you don't just take care of the patient, you equally have the family to be in good terms and in good relationship with. Number one is patient's right. You have to understand all the rights of the patient so that you will know how to act. When we get to bills of rights and responsibilities of a nurse, we will talk about the patient's right in details. Next, we will talk about advanced directives. When you are with the patient, there is what to do when medications are finished. There is what to do if you're caring for the patient that has oxygen and the oxygen cylinder is empty. There is what to do when there is an incident, there is a fall, there is a new diagnosis, there are complications of a disease condition. What to do? You must be able to understand the pathway for communication, which you will be able to carry out to take your patient to the hospital. We will get that when we are looking at community nursing. Next, surrogate decision making. As long as you are caring for your patient, you are not the only one that is taking care or that will be having the last say. It means you have yourself, you have the patient, you have the family, you have the case manager in the hospital, you have the doctor in charge, and you have the nurse that will be coming from the hospital. Is that understood? All these people all together will be in collaboration with you to make sure that we have a good decision made for the benefit of that patient. Next, the goal of care. Before I send you to a patient, I will present to you all the patient's information, and when you start duty, you will tell me your long-term and your short-term goal of care. Now, when we talk about the short-term goal of care, what happens if you come in the morning and you realize that the patient is having high glucose or high blood sugar? The fasting blood sugar was high. Hyperglycemia, what would be your goal for that day?
So we have to check glucose daily before having food.
Yes, you check the monitoring, yes, you monitor what else. You need to give me a clear short-term goal for that patient. That day, you came and you realized that the patient was hyperglycemic. What would be your short-term goal for that day?
Patient should maintain a proper nutrition diet.
Yes, that could be one of it. That should be one of it. But that is not what I'm looking for.
Proper exercise.
That can be one of it, but that is still not what I'm looking for.
We should maintain a glucose level.
Exactly. Your first short-term goal for that morning would be the patient should maintain a normal glucose range by 3 hours, by 4 hours, by 5 hours. Because if you do not give a time frame, that goal is still not respected. Okay? This should be your first short-term goal for this patient this morning. And after this, you will now be doing different things that will enhance, that will encourage, that will help you to get this patient moving. One which is you will be controlling the blood sugar level by giving either insulin, by helping the patient to exercise, by checking the meals for that patient before the patient eats. Is that correct? So this is now a short-term goal. As well as you can put a long-term goal that since the glucose level has still been unstable, you are hoping that by the end of the month, by 2 months, the patient will have a balanced glucose level, because at this time you must have initiated the patient in a regular and effective exercise program, in a regular and in a regular diet that will help the patient maintain their blood glucose level. And because you are present, you will actively make sure that the patient's glucose level is monitored and controlled when necessary. Is that understood? So that is what it comes to when we are looking at the goals. Now, the code status, we have the end of life. The code of status is what is the status of that patient at that particular moment. Is it a category 1, category 2, category 3? We will get to the category when we are looking at the mission, the vision, and the values of the company. Next, end of life. There are patients that are long-term, there are patients that are healthy, there are patients that have end of life, and they are requested of do not resuscitate. When there is a do not resuscitate, they will give you, HAMA will give us a document that has been signed by the patient or the family member for you not to resuscitate in case the patient gets into a crisis. Next, culture and religion. They have their culture. They pray at certain intervals. You saw that during the culture, right, yesterday. They pray at morning, noon, evening, and midnight, or something like that. Those periods are the period that the people will pray. And for this culture and religion, if your patient is diagnosed with suffering from dementia and cannot remember when they are supposed to pray, it is in your responsibilities to tell the patient, this is your praying time, Mama. This is your praying time, Baba, so that they can pray. Next, meditation. They equally have a period of meditation which you are supposed to respect if they ask for those moments. We have allocation of resources. Resources will be given to you, medications will be given to you, other accessories that will help you take care of the patient will be given to you. It will either be provided by the patient or it will be provided by the pharmacy, and we are expecting that you use those diligently until the time it is going to be exhausted. Next, conflict resolution. There is no environment where 2, 3, or 4 people come together that you do not have problems. As long 2 or 3 persons are in the same environment, there will be problems. However, the way in which you resolve that problem might differ. Number 5 step to conflict resolution is communication. Communicate. You don't have to be rude about it. You don't have to fight over it. Just communicate. You'll be working in partnership with a third party who could either be provided by us or provided by the family. And when you have a care partner, you have to be handing over shifts to each other. If you don't understand certain things, just communicate, ask. And the 2 of you have to be in good communication. Not you working with a care partner that you cannot talk with, simply because you're from India and she's from the Philippines, or you're from India and she's from Africa. No. Regardless of which nationality you are, you both have to take care for the better good of your patient. Is that understood? We have research, we have confidentiality. All through my lectures, you keep hearing confidentiality, confidentiality, confidentiality. Because if you disrespect this particular rule, you have your way in front of jail. Like I'm looking at you and this is jail. Okay? You must maintain the patient's confidentiality at all moments. We will talk about that when we are looking at bills of rights and regulations. Next, public actions. There are things you are not going to do. There are things you are going to do, especially when you are in the public. Do we do handover in the car? No. Do we do handover in the hallway? No. Do we do handover in the kitchen? No. Do we do handover when other family relatives are inside the patient's room? No. In the code of conduct, the protection and well-being of patient is paramount. The protection and well-being of the patient is paramount. Therefore, speaking out or taking actions in the presence of unethical practice is an essential professional responsibility that you, as the nurse, at the patient's bedside, should be doing. Nurses, now what do I expect you as a nurse to do? Number 1, you have to be competent, and that is why in this program you must take your competency exams before you are given to a patient. And that is why you are in class for a 1-month training. After the 1-month training, you'll be going for shadow. After your shadow, you will come back to take your competency exams. And when you pass, we will now give you a patient. If you do not make it, you have a second chance. If you still fail a second time, we will put you back in the stomach of a bird and we will fly you to India. You were told during interview, right? So at this moment, nothing will be repeated. Each day you have finished a course, it is finished. So you must take with great respect to learn. You have recordings, you can go back to listen to it and to hear what you might have forgotten. You will take time to learn, to get a good mastery within everything that has to do with the culture at every step. You have to go through the 5 core competency, which is administration, infection control prevention, medication administration and rights, and every other thing, physical assessment, and you will make sure you master them to your fingertips. And you attain your competency as a nurse with great experience. Is that okay? Number 2, compassionate caring. I need to see a tender, loving, caringness. Many of these people, their family, their children are married, the family is far off, everybody is busy. They are expecting that you, as the nurse, will be able to love their family, their mother, their child in a way that will give them peace and satisfaction. Next, subordination or self-interest to patient's care. It is not about you. It is about your patient. So I do not want you to put your needs above that of your patient when you're on duty. If you're at home, you can eat when you want to eat, you can rest when you want to rest, you can take your shower when you want to do, you can do anything at your convenience. But when you're at the bedside, I am expecting that you take full charge of your patient and not take 2 hours to go and eat, or 3 hours to answer a call, or 1 hour to be inside the washroom. No. Everything is timely, and you should give your patient the full time while you are there. Next, we have trustworthiness. The trustworthiness here, if you care for your patient and you make them not to trust you because of certain things you say, if you lie the very first time, there is no way a patient will trust you. I will not even trust you myself. Do you understand? I am expecting you to be truthful. I am expecting you to do the right thing, and I'm expecting you to do the right thing at the right time. You gain the trust of your patient, you will be happy as well as they will be happy. Next, we have consciousness. You should be conscious and diligent with your duty. If I have to give medication at 8, by 8 I should be giving medication. If I have to turn the patient by 10, by 10 I should be turning the patient. If I have to do a little bit of ambulation, the time that I have to do ambulation, I should be doing that ambulation. If I have to check glucose levels before administering, I should not skip a step because I'm trying to be fast. I should do it the way it's supposed to do. To be next, practical wisdom. If you get into a scenario where you suspect that there is an abuse, where you suspect that there was a fall, on a recorded fall, let's say you go home for your off day, it's Friday, and then you're supposed to resume work on Saturday. So Thursday night you left. Friday you are back for duty. Saturday you are back for duty. And when you go to duty, you identify that there were bruises on the patient. You identify that the patient might have developed a bed sore. You identify that one thing or the other went wrong. And you need to investigate. You need to know exactly what happened. I am expecting that you should use practical wisdom to get this information. Not to accuse, but yet to be able to get the truth of the care partner, of the family, of exactly what happened and why your patient is having bruises, and to open an over. You will get to see overs, you will get to know which type of overs are present and which scenarios you will be able to open an over. Is that understood? Next, humility. You should work with humility. Not being an arrogant nurse because you are working at the bedside, the housekeepers are now leading people, the maid is not important, and you walk inside your house and behave as though you don't breathe oxygen. Okay? You should be humble. And others in the house have the same rights as much as you do, or even more than you do. Because you are the nurse who comes and goes. They are the people that have been there for the longest period ever. You respect each and everyone, be it a child or an adult. Courage. I need you to use courage to do your duty effectively. Whether you are going to call the hospital for an emergency, whether you are going to take certain actions to taking stiff decisions in the family, you should be able to do that with courage. Integrity. The test of integrity will be time, will be a test of you being trustworthy, truthful, honesty, and you should do all of this while being humble. The next should be putting herself above, the next should be putting her patient above every other person. Altruism here stands for selflessness. It means you are able to you put your patient first, before yourself, especially when you're on duty. Next, autonomy. You must be able to allow the patient take decisions in the care they want you to give to them. As well as autonomy, you must be able to take certain decisions when you are about to, or when you are trying to help the patient to gain self. Because if I need an emergency, if I see a complication of maybe diabetes, pulmonary edema, I should be able to do what? To take decisions to understand that the patient at this moment is an emergency and I need to call the ambulance. Is that understood? Next, human dignity. You must treat your patient with human dignity. And here you will be talking about fairness. So whether the patient is small, is an adult, is old, to whether the patient is healthy, to the fact that the patient is especially child, to whether the patient is rich or the patient is poor, you must treat them with integrity because they are human beings. Next, social justice. We will equally here, we'll be talking about fairness and cultural competency. That is why yesterday, the first thing you were learning is the culture of the people in Qatar. Who are they? How you can dress, how you cannot dress, what you can do, what you cannot do, because we must respect their culture in order not to violate them. Now we know during the culture that you are not permitted to stretch a hand to salute a baba or the son. Even the daughters, you bow and you greet. If a daughter decides to greet you, then you do that. But you cannot extend a handshake to an opposite sex. Next, I have already defined what autism is. You must be able to care with empathy. You should care. Deep, loving, tender care to your patient. I have already defined all of these: integrity, social competence, autonomy, beneficence. To be good, of course, we've explained this. Non-maleficence, you do not have to inflict any harm on people. You do not have to cause pain or suffering to your patient. You do not have to be incapacitated. You cannot cause harm to the patient. Next, you do not have to cause any offense, be it minor or major. You do not have to deprive your patient of their integrity or their privacy or any other thing. You do not have to kill. These are the things that you cannot do. Next, justice. Justice, I said, you must treat everyone fairly. You do not have to favor individuals or a certain group of people. You have to act in a non-discriminatory way, be it a child or an adult. You have to respect people's rights and respect the law. Ethical rules and regulation. We'll be talking about privacy. You maintain the privacy of the patient. We already talked about this. Confidentiality. Ethical dilemma. Ethical dilemma here is a situation that arises when equally compelling. What does that mean? You are in an ethical dilemma. You came on duty and there is something you have to do which is right, but the patient wants you to not do that. Let's say for an example, the patient is suffering from dementia. In the morning you check the blood glucose level, it was high, and you gave insulin. That is correct. But now within 5 or 10 minutes, the patient just remembered that the insulin was high, but did not remember that you gave insulin. That the glucose was high, but did not remember that you gave insulin. And then the patient says, at this moment, you must give me the insulin. What will you do? You will educate, you will explain, you will show evidence of what you did to the patient, just so that they can have peace. You will not insulin again just after 10 minutes, simply because the patient is insisting that you give insulin. If the patient was supposed to take medication by 8 and tells you, I don't want to take the medication, what will you do? You will explain the importance of the medication, the effect if the medication is not taken when it is supposed to be taken, and why the patient needs to take that medication. You are going to find yourself in a lot of ethical dilemma when you are in the patient's home, because it will not just be dilemma between the patient and yourself. It will be decisions that will be made by the family whom they are expecting you to implement, but you cannot because it is against your rules and regulations. Let's say you are at home. You have been given, by the time we are sending you to a patient, we have given you all the medical file for that patient from PNs. And then the doctor comes and tells you, this is a medication I want you to give to the patient. What will you do? Exactly. You will not give that medication. You have to explain to the doctor that I am sorry, as much as I want to respect you, but this is against the medication regulatory rule for me to administer a medication that was not prescribed by a doctor and by PNS. If she tells you this medication was prescribed by a doctor friend of mine, yes, it was administered by a doctor friend of yours, but it is not in my medication list. So if there is an assistance for me to must administer the medication, you will call me and inform me about it. And I will tell you to call the home office. You will call the physician and you will indicate to the physician that the doctor has given you a particular medication and this is the medication, this is the function. You will send them a screenshot or you will snap the medication and send to them a picture of it. And they will decide if this medication is equally important to the patient. They will add the medication and the prescription to your medication list. And then you will call me and inform me about that call. And I will send you an updated medication list that has this particular medication on it. And you can then continue to give. If you call the physician and the physician tells you this medication is not necessary for the patient, you will equally tell the family that I am sorry, I called the physician. The physician indicated I cannot administer the medication. Is that understood? Ethical issues. Now, which are the issues that you are going to face? When you have to judge what is wrong or right, these scenarios are given, is you going to judge if this is right or it is wrong. Next, choosing between options. Should I administer or should I not? The family believes it's right. Your ethics says it's wrong. So what am I supposed to do? Next, deciding whether to do something or not to do something. Your patient is insisting that you give them insulin, even though you just gave the insulin. We know that insulin is a high alert medication, and if you have to repeat that insulin within short intervals without any necessary cost for administration, it's going to cause harm to the patient. Next, should I do or should I not? Watching weight up with the potential impact of decisions and actions. So these are some of the ethical dilemmas that you are going to face, and you are going to be deciding what to do and what not to do. Ethical decision making. Identify the issue, the ethical dilemma. You should identify that particular thing that is giving you the dilemma. Is it medication? Is it patient? If you already understand that your patient is dementia, you should not be surprised that the patient is asking you to administer medication even though you just administer the medication. So because you know, you will not have a way to solve the problem without creating it even bigger. Because you already know that the patient, the doctor just came with a prescribed medication from somebody else, you are not going to say, oh no, I cannot prescribe the medication because it's not on my medication list. You will know how to manage it. It is not out of the blue, it is not out of hate that the doctor brought a medication. She too is trying to make life easy for the mother. It is you who has been educated about the rules and regulations for you to come and tell her nicely on how the procedure will work. It's okay, ma'am. I know that you really want to give this medication to your daughter. Let's do it this way. I will call the physician and I will explain the physician the medication that you have brought. If he feels that this medication is okay, he is going to increase or he is going to put it in the medication list and we will be given an updated list. Then I will administer the medication. So just give me few minutes, few hours. Let me try to see how this medication can be included in the medication list. If you call and the doctor says no, you come back to tell her, ma'am, I have called the doctor and the doctor does not find it necessary to give this medication. So I will plead with you that it is out of the profession's rules and regulations that I cannot administer this medication. You are giving to one patient, not to two patients. So if you go to the patient's home, you are taking care of mama, but baba is equally sick and they want you to start taking care of baba. You need to tell them nicely that you were sent here as a priority to take care of mama. If they need a nurse for baba, they should go and request for one. Nicely, of course. All right. Let me see. Identify and analyze available alternatives. List all possible actions. You need to see other ways in which you can solve the problem and not necessarily attack it. Next, select one alternative. Step back and consider the situation. You select one alternative and then you see the possibilities in which you can solve this problem without necessarily blowing it up. Next, justify the situation. Why am I doing this way? For an example, this morning one of the nurses called that the patient's oxygen cylinder, the portable oxygen cylinder is empty. And they were keeping it, they did not show her. So it is today that she noticed the cylinder. So when she went to ask why the oxygen cylinder was empty by the family told her, you either request for a new one or we don't want to see you here. Initially that will upset you because first you are trying to solve the problem, but now they're making it look like you were the one at fault. I did not notice, I'm a new nurse, I just realized this cylinder and I'm coming to bring you that the cylinder is empty. But instead of getting angry, she called me. I said it's okay. The family is just saying it out of concern. Now what should we do? Let's call the pharmacy and indicate to the pharmacy that the cylinder is empty and we need it refilled, and then they will take it from there. So she called the pharmacy and the pharmacy said, by 10:30 we'll come pick it up. And by 3:30 we'll bring it back. Problem solved. There's no need to be emotional about it. Do you understand? Next, legal and ethical elements. What are the legal and ethical elements that if you do, it is not just going to be at the level of the company to discipline you. It will be at the level of the judicial system of Qatar. Number one, malpractice. What is an example of a malpractice you can do in your company, in the patient's bedside? Number one is the fact that you went to the patient and then they tell you, oh, mama is having abdominal pain or mama is having constipation. What can you do? You took your pen and prescribed a medication for it. That is against the rule. This is a malpractice. You are prescribing, it is not in your job description to prescribe. Now imagine that you didn't when bought that medication brought to mama. Mama took the medication, it got a side effect or an allergic reaction, and then she passed away. Who killed mama? You. And you'll be going to jail. You will not even see me. Do you understand? Next, negligent. You get on duty, instead of working, you're sleeping because you're working night. And because you were sleeping, the patient got into breathing difficulties, the patient got into a cardiac arrest, the patient got into hypo or hyperglycemia, the patient went down into shock. You did not notice because you were sleeping. And because of this, it causes harm to the patient. You are going to jail. You have been neglecting the patient at home, keeping the patient on long hours with diaper without changing it, and now a healthy patient that was given to you now has bed sores. You are the problem. And if the patient is firmly taken up, you can go to jail. Next, abandonment. You are working with the patient, and because they said something that offended you, you got into the patient's room, took your things, and left. No, you don't do that. You will have to call for me. You will have to explain to me. I will have to see ways in which you solve it. You are not permitted to leave your patient and then disappear. Is that understood? Next, a felony, a misdemeanor. A misdemeanor. This is a light offense. Maybe we can put a misdemeanor to be an assault. You slapped your patient. The patient said something, you got offended, and you went to jail. Hold on. You have a 1 ticket to prison. A felony. You got mad, you remove the patient, you unplug the patient from oxygen, and the patient died. You are never coming out of jail. You just have a new profession which will be staying in jail. I think you will be a good fit to be a nurse in jail. That they will still not trust you with it. Is that understood? Giving medications to the patients that are not supposed to be given. We have seen documentaries where nurses, doctors have gotten psychotic and killed their patient. No, you are not going to do that. You're going to be fit. If there's a problem, if you feel like you are now not feeling right, not acting right, you should tell me on time so that we can get you help. Is that understood? Next, on professional conduct. What can we talk about here on professional conduct? You have a relationship with your patient. Let's say you're taking care of a special need man, and then you start having a relationship with that person, and then you get pregnant. Or you start having a relationship with one of the fathers. Do you know what that is doing? This is unprofessional conduct, and you are questionable to it. Let's say a male nurse started having a relationship with a special needs child who cannot give consent. You are not supposed to have a relationship with any of your patients, or their relatives, or an ex-patient. But then if you have a relationship with a patient who cannot even give you consent, jail will be your second home. Is that understood? Okay. Assault, battery will fall under misdemeanor, and in a severe case, they can put it under felony. Is that understood? So in either of these that you do, you will be answering with the court of Qatar. Not me, not PNS, not the office, nothing. You are on your one-way ticket either back home or one-way ticket to jail. Okay. Negligence and malpractice, I have explained all of this already. We have practice by the nurse which may consider unethical. Practice by the nurse which are considered to be unethical. We have one prescribing medications, we've spoken about that. Doing decapitation of stillbirth child, you are not a maternity nurse, so I will not bother about that. Conducting obstructed labor, we are not in the maternity. Delivery when presented to placenta previa, getting registered, done by false means. Dishonesty use of certification, taking bribes, using the derogatory terms in professional nursing, theft, cheating, immoral act, habitual use of drugs or alcohol. The people here do not necessarily drink alcohol, but we are expatriates that are here. So some of us drink. I don't take alcohol. If you must drink, it should be on your off day, and it should not be the time when you're going to duty the next day. And if you must drink, you should drink in such a way that you are not drunk. And you are not permitted to drink drink in the accommodation. You are not permitted to store alcohol in the accommodation. You are not permitted to sell alcohol in the accommodation. You can go to the hotel and drink. And before you think of drinking, you should get yourself a license for an alcohol permit. Is that okay? Negligence and abuse explained already. So now let's talk about the American Nursing Association Code of Professional Conduct. Number 1, it says that what? Nurses in all professional relationships practice with compassion, respect for inherent dignity, worth, and uniqueness of every individual. This has been explained. Next, nurses should promote, advocate for, and strive to protect health, safety, and the right of all patients. Next, number 4, the nurse is responsible and accountable for individualized nursing practice and determine the appropriate delegation of tasks consist with the nursing obligations and optimum patient care. Number 5, they owe the same duty to themselves as others, including the responsibility to dignity and safety. Now, I am not expecting you to leave the accommodation to go to the patient's house. You clean the patient, you give food to the patient, you make sure that the patient is healthy, and you cannot do that to yourself. The first person to be safe is you. If you are sick, you should tell me that, Mom, I cannot go to duty, you are sick. As long as you tell me within 8 hours before your duty, or minimum of 3 hours before your duty, I will be able to handle that, manage it, and send to you a reliever. Because I expect that you should be healthy, you should be happy, you should be in a better state of mind to be able to take very good care of your patient. Without that, you are simply going to be a danger to yourself and to your patient. I don't want you going on duty and collapsing in front of the patient. What do they do with you? Are you understanding? So you must give the same dignity and respect and care and love and compassion that you're giving to your patient. You must give this to yourself. Is that understood? Okay. Next, the nurse must establish and maintain improving healthcare environment and conditions of the employment. We need to always check. You need to check your employment, you need to check your licenses that they are on track and every other thing, and make sure that you are still in line to work. I'm not the one responsible to make sure that your licenses should be clean. You have classes that you have to take within 2 years and points to be able to renew your license. I'm not the one to run after you to take those classes and get those points. You have to consciously do them. However, if I see that there is a class that I'm taking, I can share it in a group for each and everyone to go to it. I cannot force you to do it. But at the end, when you have 3 months to the expiration of your license, I am expecting you to tell me, Mom, my license will be expiring within 3 months, so that I start making preparations for you to get them renewed. And so forth and so on, which we have discussed. So tell me, do you have any question with regards to this? I will talk about it. Anywhere you want to ask, anything that was not well explained? Okay, let's go ahead. Now, what happens in case that all of the code of conduct is not respected the way it's supposed to? We have one. The values, the rules, the standards, the principles that companies expect from a staff within the organization. This is an organization, and what we expect you to do is personal grooming. You should be able to take care of yourself in a good way. Qatar is hot, and because Qatar is hot, you might sweat excessively. You will need to take shower at least 2 times a day, in the morning and in the evening. You need to use a roll-on. You don't necessarily have to use a perfume, because perfumes, different people might have different reactions to it. And because you are taking care of a patient, we are not expecting you to wear a perfume, except the family or the patient requests might give you a particular perfume for you to wear. If not, no. You use a roll-on to keep you dry, and you clean yourself as much as possible. Next, attendance. You must, for now you are still in class, you must attend classes from 9 to 6 to 4 every day. And if there is a reason why you will not be attending a class, you must let me know. Next, behavior. I am expecting you to be in your best behavior. No mood swings. We are all ladies, we all gotten periods, we all gotten hormonal disorders. I don't expect you to be throwing tantrums on people. No, you have to behave yourself. Next, performance. I am expecting you to be in class, to be alert, to ask questions where you don't understand, and to interact. Okay? Next, failure to report to work at least 6 to 8 hours before shift without further notice. If I got up one morning and you were supposed to be on duty by 6, and then you are telling me by 7 that you are not going to duty, that is not even going to sound funny. You will be having a disciplinary action and possible deduction for that. Next, insubordination and refusal to comply with instructions. Now, this duty of ours is a duty where instructions keep being given and changed. So I do not just want you to be ready to receive instructions and implement them, but I am expecting that you adapt and adopt to the changes. If today it is right that you tell your patient 6 times during your shift, and tomorrow they said you should be doing that 8 times, I expect you to do the changes. Don't say as it was in the beginning is now. No. It does not have to be forever shall be. You can change. Next, privacy and confidentiality. I am expecting you to maintain a level of privacy for yourself and your information, as well as respect and maintain a level of privacy for the patient. I don't expect you to go and then you start telling the patient how your husband or no, out of question. Neither am I expecting you to start asking another nurse on their privacy and things they do not want to tell you. Now, if you have a friend, now you are in the accommodation, there are many other nurses, you meet many other nurses from India. If you have or decide to pick one of them to be your friend, it is okay. If the two of you gossip about each other and your families and talk about your problems and talk about, it's okay. But if you are not friends with some other nurse, I'm not expecting you to go outside her personal problems. It has nothing to do with you. Concentrate on your duty and go home. Is that understood? I am equally not expecting you to go to the patient's side, and because you have a care partner, you start telling the care partner about your problem and every other thing for the company for this. It has nothing to do with it. You are there to do your duty, do it and leave. If the family or the patient start asking you too much details of your work or of your relationship or of your family, you need to tell her, thank you so very much, Mom, for the questioning. I am sure I would have loved to share, but it is against company's rules and regulations. Is that understood? Correct actions. Company response to misconduct, performance, and company's rules and regulations. We have one. One, it aims to correct, address the opportunities, not to punish. Now, if you do something and I call you up first, if you do an offense, I will give you verbal warning. I will warn you and I will give you the way forward. This is how I expect you to handle this kind of situation. Number 2, it depends on the situation and the severity. If it is severe, I might call you up to the office, I might give you a written warning, and you are only permitted to receive what? 2 warnings. The next one is a final warning, which will come with deduction, which will come with penalty. You might be asked to stay at home or in the accommodation for 2 weeks without pay. Our profession is something that either saves lives or causes harm to life or takes life. I am expecting that we are all living and abiding with rules and regulations until the very last day. Is that okay? It is too much of a high-risk profession that does not necessitate that you keep doing errors every now and then. It needs you to be in actions and do the right thing. Profession operations, progression operations, that is what I said. One, you have a verbal warning. 2, you have a written up statement, warning indicating the violations and how you have to go about it. You have a wake up call. I will tell you what you did, the severity of what you did, and how you need to go up. 2, I will give you a written warning, and on the written warning, I will give you the actions that you have done and the conducts that you have violated and what we expect you to do next. But when it continues, I will give you a final one. The final one will either come with what? Number 1, there will be an investigation of the actions that have been done. Number 2, there will be documentation of the act. Number 3, you can either have a temporary suspension, or you have a long-term suspension, depending on the severity. If it is a case of an assault, a negligence, or a relationship you're having, they might keep you for a long time because investigations has to take place. And after everything, if it comes to maybe an actions of a misdemeanor or a felony, you might be in police, and of course your contract has been terminated already. So they can either send you back home from the court, or they can send you to jail, to a new home. That now will depend on them. Is that understood? So we are not just fighting to save life, we are equally fighting to make sure that we don't go to jail. Is that understood? Next, chain of command. What is the chain of command that you need to follow from now henceforth? Number 1, I am your first chain of command. It means if you are moody, you are sad, anything that happens to you that you need to talk to anybody, I am your first chain of command. You will need to tell me, I will see to that I relay the information to the director of nursing. The director of nursing will take it to the administration or the resource manager, and they will take it to the manager. Is that understood? So this is your chain of command. In case you want to talk to the head of nursing education, in case you want to talk to the quality, in case you want to talk to the infection control, in case you want an appointment and you need a driver, I am the first person you are going to talk to. Is that understood? Now, if you skip this chain of command and I get the managing director coming back to ask something that has to do with you, you're certainly going to get yourself in a single action. Is that understood? Okay. Conflict resolution. I already talked about conflict resolution on communication, understanding, and fairness. Complaint. Inevitable. There will always be complaint. However, you must express your dissatisfaction and discomfort in a way that another person can accommodate. Grievances. A formal way for the staff to raise a problem or complaint to the employer. 1. Raise a grievance if their review raised informally has not worked. So if you call me, Ma'am Aisha, I think that I have a shortage in salary, there's a 1 day off. You call, I will take it up. Now, if you do not see me actively getting back to you to give you the solution of reasons why you're having a 1 day off, you can write me formally in an email. That email, I will print it up and I will take it up to the administration. Okay? If your driver has been coming late to pick you up and you have a problem with the family because you're coming late, I am expecting that you can say that in a formal way and that will be solved. Is that okay? Next, appeal. Now, the steps in which you can get your grievances listened to. Number 1 is the informal way. You just calling me, you sending me a WhatsApp text. Good morning, sir. Are they outside? He has finished with the nurses? Finished? No. Where is Jacqueline?
Here.
You want there? You want to go? Okay. You can go. It's okay. Okay, you can go. I don't need you. If you are finished, you are finished. I don't have any problem with you. Ma'am Jackie, please come with a little bit of papers for the nursing assistants who are here. No, just come with some papers that they can jot certain things in case they don't remember. And my folder, you don't know how to navigate it. I need the leave forms. Let me finish with this. I will come for it.
Okay.
Okay. So, sorry. Welcome. So, how do you see Qatar?
It's not new for her.
Okay, you were already here and then you went for vacation?
No, it's new here, but last 6 years ago.
Last 6 years ago.
Yeah.
So you left Qatar last 6 years ago. That's a long time.
Yeah.
You're coming for the very first time?
Yes, here in Qatar, but I was in Saudi.
You were in Saudi.
Yes.
Welcome to Qatar.
Thank you.
So I hope that you enjoy yourself here, and I hope that this gives you a fulfillment to your next level. Okay? All right. You came when we are about to finish our code of conduct. We just have few notes. I will finish this with her, and then I will start all over again with you on the general conduct of the company. Okay? When you check under my drawer, the last drawer, you will see the code of conduct for caregivers.
Okay.
Give me 2 copies of that so that I can give them. Okay. So you don't need to write here. When I start with you guys, I will let you know. Okay? All right. So for the grievances, we will have the informal and the formal. As I said before, you can call me, you can explain whatever is disturbing you, and then I will take it from there. But if this is not working, you sent me a formal email. Did you see the email, my email yesterday? I will give you. Next, we have the discussion of the grievances with the grievance committee and staff. 2, the decision is written usually within 24 hours. So if we have a problem and we come up and we talk about it, within 24 hours, they will give you either a solution to your problem or the disciplinary action that has been decided upon you. Next, appeal. If the staff is unhappy with the decision, usually it takes 5 business days with the senior manager or the owner. Decision is within 24 hours. So if something happened and then you come up, maybe the family calls and give a complaint that Kapana has done this and done that and done that, and you came to the office and we were talking, and you feel like the decision was unfair because you realize that you actually did not do anything wrong, this is a setup. It is okay for you to still send an email to me indicating that you thanking me for receiving your disciplinary action or whatever decision has been taken, but appealing that they should look deep into it because this is actually not your fault. Is that understood? Okay. Root cause. Now, for us to be able to take a particular decision, we are not just going to get a call from the family saying that, oh, this nurse is doing this, and then we start giving you disciplinary action. No. Neither are we going to receive a call from you indicating what the family has done, and we just start taking disciplinary actions or calling for a grievance meeting. We will have to do investigations. The investigations will come to reason why, what, and the solution to that problem. Yes, what does it say?
Comprehensive PPGs for caregiver operations.
Yes, for caregivers. Give me 2 copies. All right, take 1 here and 1 here. Okay, so it is not just going to be us deciding. The first thing is, the problem is as a result of your performance, that is your skills and knowledge. Is the problem as a result of your behavior to the family, the conflicts and complaints, or is your problem as a result of conduct? That is, insubordination, refusal to answer calls. Maybe I'm calling you for a particular thing and you're not responding. No, you have to respond, okay? Because at every stage, something might be changing somewhere and I need to pass this information to you. Are we communicating? Okay. Importance of addressing these issues. The importance of us addressing every issue is because I do not want you to be on duty and unhappy and carrying grudges over to you to be on duty and doing the same error over and over. As a PNS nurse, you have a lot of documentation to fill. And if I have a problem because of you are not filling your medication sheet correctly, we must address that concern until we get it right. Is that understood? If I have a problem because you are not using your health literacy tool correctly, we must address this thing until it gets it correct. Now, if I correct you and I come back and I make the same error, and I correct you and I come back and make the same error, it will mean that you are not compliant. It is not because you are not taught. It's not because you do not understand. It's because you don't want to do the right thing. Is that understood? Okay. Nurses must adhere to the standards and the behavior of the nurses between patient and family. I am expecting you to have an open communication with whatsoever the problem might be. Is that understood? When the nurse feels unsafe due to the following circumstances: 1. Harassment. Either the harassment is verbal, physical, or sexual, consider triggering factors. However, as long there is harassment, whether verbal, physical, or sexual, I am going to start the investigation immediately. And the investigation might come with certain how you dress, how you speak, how you behave. We will consider what is causing this harassment to come. Next, safety in comprehension and the nurse's patient boundary. We will educate. There is why PNS have a family conference. The family conference will be held to educate the family and the nurse about patient, the nurse and patient boundaries, where the boundaries are, what the patient can do, what they cannot do. And next, in all concerns, communication should be to the supervisor, explaining to me what happened. Is that okay? If there is physical abuse, immediately, as per PNS, I have the right to stop your duty and to remove you from the patient. And then investigations will start from there. But you have to communicate with me immediately something happens, so that I equally start the investigation and report to PNS immediately that thing has happened. Is that understood? Okay, so until now, this and everything that we have spoken is the code of conduct that you are supposed to work with. What you should do and what you should not do. Is this understood? Do you think that if I send you now the pre-test, you will be able to manage? The post-test, you did pre-test already. So I will send you the post-test and I will send you the evaluation, and we can start with general code of conduct with the caregivers. And you can submit your this for signing. I think it's still morning, we might have one more class in the afternoon. Is that okay? I will finish with them and I will let them go. Thank you so very much. I have a call from Mo. Perfect. Yes, sir. Good afternoon. I don't understand, sir. Yeah.